Hello everyone. Today I would like to discuss about de Quervain's disease, which is also known as smartphone syndrome. De Quervain's disease is one of the most common diseases in our hand. People who engage in activities which require side motion of the wrist, like this, and gripping with the thumb, such as like a hammering or skiing, are more likely to develop this condition. The population at risk is increasing recently because of frequent use of smartphone. This is why de Quervain's is also called a smartphone syndrome. The three main points I'll be speaking on today is 1. Giving you clinical information about what de Quervain's disease is. 2. What is the risk of it and who are at the risk? 3. Prevention and treatment of de Quervain's disease. So, what is de Quervain's disease? De Quervain's disease is a painful inflammation of tendon in the thumb which extend to the wrist. This is because the swollen tendon and their coverings rubs against the narrow tunnel through which they pass. We call this inflammation tendon or tenosynovitis. So, what are the symptoms of de Quervain's disease? Pain, of course. Pain along the back of the thumb is a common symptom in the de Quervain's. The condition can occur gradually or suddenly. In either case, the pain may travel into the thumb or up to the forearm. Thumb motion may be difficult and painful, especially when you pinch or try to grab an object. Some people also experience swelling and pain on the side of the wrist at the base of the thumb. The pain may increase with the thumb and wrist motion. Some people feel pain if direct pressure is applied to that area. So, what causes de Quervain's disease? Overuse is most single cause of de Quervain's disease, or direct trauma or injuries to the thumb, repetitive grasping, and certain inflammatory conditions such as rheumatoid arthritis can also trigger the disease. Gardening, racket sports, and various workplace tasks are some activities that can aggravate the condition. It is also seen during the last trimester of pregnancy women or in mothers of nursing children. According to a clinical study, it is also related to the rheumatoid arthritis. So, how can we treat de Quervain's disease? Treatment of de Quervain's usually involve wearing a splint 24 hours a day for 4 to 6 weeks to immobilize the affected area and refraining from any activities that aggravate the condition. Icing area may be applied to reduce the inflammation. If the symptoms continue, the doctor may give you anti-inflammatory medications such as naproxen or ibuprofen to decrease pain and swelling. If de Quervain's disease does not respond to conservative medical treatment, surgery may be recommended. After surgery, the doctor will recommend an exercise program to strengthen your thumb and wrist. Recovery time is vary depending on your age, general health, and how long the symptoms have been present. So, is there any way we can prevent de Quervain's disease? Of course. Avoiding repetitive movement is most important way to prevent de Quervain's tenosynovitis. Changing your action to reduce the stress on your wrist and take frequent breaks to rest is also important. Wearing a brace or splint when you have to use your thumb and wrist is recommended to protect your thumb. Stretching and mobilizing your thumb joint and wrist joint followed by strengthening exercise will be also beneficial. Make sure to decrease activity that cause pain, numbness, or swelling. So that's all about Dick-Rovin's disease. I hope my presentation helped you understanding what Dick-Rovin disease is. This condition is something sounds not familiar, but it is very close to all of us. If you are a big fan of smartphone, pay just a little bit of attention to your thumb because Dick-Rovin may be so close to you. Thank you.